working? Is the stream picking up the audio and all is good? Okay. Good morning. Welcome. Thank you for coming. Thank you for making your way through the gauntlet to Sproul Hall. We figure we'll be able to get through this meeting and most of our work day today, but we are certainly glad that this meeting is scheduled for the morning and not the afternoon. Thank you to those who came, and thanks to those of you that are streaming. I don't have much to say other than I just wanted to point out we didn't pitch that there would be gifts today, but there are stress bears at the back, and I've already enjoyed this massively. So I really recommend you guys check these out on the back. This is going to be a more interactive meeting than some because our colleagues from University Health Services who will introduce themselves and talk about the varying topics they're here to share and hear from us about. So my colleagues and I are going to run microphones around so that people on the stream can hear what we're talking about and participate via the chat. But please be patient, and we'll try to make sure everyone is heard. And now I'm just going to turn it over to Bahar Navab, who is actually not only a staff member, one of us, but she's also a grad student. So I've known her for years in that realm. So it's really exciting to have her here to help us work through some of our wellness issues, and she's our SHIP guru on campus, so she'll be talking to us about SHIP today as well. So thanks for coming. And
great, thanks. I think I'm loud enough, right? Yeah? Great. As Andrea said, I'm Bahar Navab. I am the Insurance and Information Manager at the Tang Center. I am also a PhD student here in the School of Public Health. I just need to finish my dissertation. I say just, but it seems like it's a really long road. You guys know how that goes. Anyway, thanks for having us. My colleagues are here as well. This is Bene Gatzert. Do you want to introduce yourself really quickly?
Sure. I'm our strategic initiatives manager. Work with students around a lot of health and wellness issues with some different communities that they will part of.
My name is Kim LaPean. I'm the communications manager for the Tang Center, and also do a lot of outreach with.
So we're actually going to speak to you guys for the bulk of this time about a project called the Campus Network, and then we're going to switch over to more UHS and SHIP-related pieces. But so a little bit of background. The Healthy Campus Network is an initiative started by President Napolitano in December. She sent out a letter to all 10 campuses saying, and it's on your paper, but she said she wants to make UC the healthiest place to work, learn, and live. And so that's a really ambitious and broad goal. So she's tasked every chancellor to come up with a 1 to 3 year plan with a steering committee and goals of how to reach this ambitious goal of making us the healthiest place. So on our campus, Claudia Cavello, who's our executive director at the Tang Center and is now an AVC in Student Affairs, was tasked as heading up this project. And we've put together a really high-level steering committee that's guiding us through all of this. So our steering committee is made up of Joe Magnus, the head of HR, Mia Settles-Tidwell, who is the Vice Chancellor of Equity and Inclusion's Chief of Staff, Jenny Kwan, who works in the Chancellor's immediate office, the Dean of Students, Joseph Greenwell, Andrea Rex from GradDiv that you all know, Claudia Cavello, and then Kenna Hazelwood Carter, who is the GA President. So that's our, and Angie Stacy, who's the Faculty Welfare Committee Chair. So that group has been meeting and has started strategizing about what it means to make Berkeley the healthiest place to live, work, and learn. And as part of that, we're engaging with really high-level stakeholder groups like yourselves. And so you're one of our priority stakeholder groups that we really wanted to reach out to, not only because of your role with students, but because of your individual experiences as staff. And the steering committee has really identified the staff as a priority group that we want to focus on as part of this Healthy Campus Network initiative. And so we are definitely interested in hearing about your own experiences, not just in your role, but as staff members. So this is really going to be more of an interactive session. We're going to ask you some questions, and we want to get your feedback, and it's really going to help inform our work with the Healthy Campus Network. Larissa, do you want to introduce your role? I didn't say that. Sorry, I realized that too.
Hi, I'm Larissa. Larissa Tarsanway, you all know me. as the graduate student life coordinator, but I've also been involved as a part of a subgroup with the HCN initiative, but working specifically on a wellness portal, which will also be introduced.
Yeah, so again, as part of this Healthy Campus Network, we've identified 5 projects that we're going to be working on, but they're still really in their infancy, and that's where you all can be really helpful in informing how those get shaped and move forward. And they're at the bottom of your paper, but I'll introduce them really briefly. One is a wellness portal targeting faculty, staff, and students. So the idea is really a one-stop on the internet where we would have resources and maybe a call to action and different things targeting wellness on campus. And we're going to talk a little bit more about that in the second half of this. We also have something called the Healthy Department Certification. This is really, I think this is going to be the baby of HCN really, but essentially the idea is if we can define some minimum thresholds of what it means to be a healthy campus and define broadly everything from ergonomics to how your managers prioritize wellness in the department. Is it part of performance evaluations? Is there policies in place that allow for wellness, whether it's flex time or something else? To is there a break room, a meditation space, resources for staff, et cetera? So it's pretty broad, but we're still in the infancy of defining what that threshold is. And then there would be grants tied to this that departments could apply to help get them to that threshold. Or if they're already at the threshold, to get them to the next step of the threshold, beyond the threshold, and to start implementing programs and policies that will allow us to not just be healthy departments, but work that into our infrastructure here on campus. The other couple pieces of the projects related to this, there's a nutrition policy that was written up but never implemented on this campus, and so getting that formally implemented is part of this. The system-wide UCOP is looking at a system-wide health goal too, and theirs is around stairwells. They really want to encourage people to take the stairs rather than use elevators, and so for them this really came out of a project at UCLA where, I don't know if any of you have been down there recently, but they have signage all over all of their elevators that really are fun and exciting and direct people like, hey, did you know the stairs are over there? Or want a quick workout? Take the stairs. And they've also revamped their stairwells to make them more appealing. And so they're looking to expand that on all the campuses. And so as part of this, we would pilot one building on campus and see if we could, put in better lighting in their stairwells, make it safer, and then encourage people to use the stairs. And so that's going to be happening as part of this. And then the last piece is really partnering with Joe Mackness's team and Vice Chancellor of Equity and Inclusion's team, because they're rolling out some new initiatives and working with them to say, what are the synergies between this and how do we integrate wellness into those programs and planning for things that are happening in HR and E&I. So that's a really broad overview of the projects that are underneath the Healthy Campus Network. But the rest of this is really, we want to hear from you all. So part of what we wanted to start with is when you think about wellness and campus climate and infrastructure and policy, what is your vision for a healthy campus?
Thank you. Fundamentally, I see real conflict because I just think there's just too many staff being laid off, and those of us left are overworked. I mean, their stress is constant, and we don't get pay raises, hardly. I mean, 2% every how many years?
Sure.
Until those things are addressed, we certainly won't be the healthiest campus, really.
Mm-hmm.
Sorry, I just have to say.
No, and let me be clear, this is really, there is no wrong answer, there is no bad answer. Barriers to a healthy campus are absolutely valid, and it's actually been a really big part of what the steering committee's talked about too. And so while the question is formed as what's your vision for a healthy campus, it's fine for you to share barriers to that as well. So please be honest in your responses. The honest responses are really what helps us not just move the needle, but try to make bigger leaps forward. Others? Yeah.
Yeah, I was thinking when you were mentioning the stairwell, I mean, they don't even clean our stairwell. Our stairwell's dirty, and I take the stairs a lot, so, I mean, that's another thing, is cleaning up.
And Larissa is taking notes on everything you guys say. So if it looks like I'm not writing anything down, Larissa's being our note taker today. Others?
I know there are currently initiatives out there for staff already through the Tang Center, like classes that we can take and things, but often you have to make a choice between eating lunch and going to one of these activities. So having activities scheduled throughout the day, and also encouragement to management to allow staff time that isn't the time that they would be getting nutrition to go to these kind of wellness activities. So, you know, that's just kind of in keeping with the spirit of having a healthy campus. There has to be time made for the healthy campus.
Time is, I will say, probably the most common theme that has come up in our stakeholder meetings.
Hi. During my time on campus, I've experienced some real issues with management and a lack of oversight, and feeling like our complaints and also our suggested solutions have not been heard at all and really just get buried. And that has really contributed to huge drops in morale in some of the departments that I've been in.
To the extent that you feel comfortable, it would also really be helpful for us to know when you feel not heard by faculty versus other staff managers, just because there is a dynamic too between faculty and staff versus staff and staff. And so to the extent that you feel comfortable, it's helpful for us to understand which issues are with faculty treatment of staff versus staff managers. There's a couple of people in the back and one right there too.
I think you spoke to this a little bit. I think that there's still this value that's put on putting in extra time and extra work, such as like in reviews. Like in my reviews, it'll say positive things like she puts in extra hours without asking and things. But it's like, if I had a choice, I wouldn't. You know, like I don't want to. But there are certain things that need to be done, and that kind of meets that expectation. So putting an equal value on taking care of yourself as putting in extra time when you can. I think it's still like that cognitive dissonance. Like, yeah, we understand wellness, and it's important to have that balance, but it's not rewarded in the same way as putting in extra time.
Mm-hmm. Thank you.
I would love to see an effort be made to make the gyms, the two RSF locations, be more financially accessible to staff. And then a big barrier, I think, to working out, because of course gyms aren't the only place you can work out.
Sure.
And there's WorkFit, which is great, but it's hard to do if you then have to be super sweaty for the rest of your day. So that's
shower
really,
access.
Exactly. And if and I think that's tied into the gym as well.
Sure.
Yeah. Similarly, I would say that one of the things that I found actually really helpful for work-life balance or wellness is the WorkFit program, and that it seemed to expand in the last several years. So when my time is such that I can take advantage, in the summer it's easier. But similarly, the counterpoint to that is just that work demands are so intense that I can't take advantage of it for weeks and weeks on end because I just can't afford the time. Sure. So it's hard to take advantage of what exists, which I found helpful when I can, because the work demands are so extreme.
Mm-hmm. Yeah.
So one thought I have is that university mandates SVS Age, which is wonderful. It's interesting, though, that that's the only thing they mandate on mental health, or shall we say preventive situation like that. It would be interesting to know if they looked at other issues and actually mandated those sorts of opportunities for health, for emotional and mental health as well.
Sure.
So it's interesting that it's one versus many. And it seems that managers respond to the one, but not necessarily the many. So I don't know, it's a top-down sort of question is what I'm trying to think through a little bit through this whole process. So just putting that out there.
No, I appreciate that. Thank you.
So when I think about wellness, I think about emotional wellness versus physical wellness on campus. And I think right now, to me, what I'm experiencing in my department, like that's the more pressing issue.
The emotional wellness.
Yeah, and like just the relationships between staff members. So I'm fairly new in my department, but people in my department who've been there for years and years, like more than 10 years. So they've known each other for a really long time. And then there just this gets to be a lot of like tension and like a lack of trust, which
Between
is weird.
staff, you're saying?
Yeah, and which is strange because it's like you've known each other for that long that there's just so many times for things to get hurt and not enough time to heal. And then management tries to do like these team building things and everybody rolls their eyes and they're just like not that effective. And then that also goes with the faculty too. Like there's a lot of like isolation and it's, I'm just realizing, oh, this is getting streamed too, but I think I went from 2 different departments, one where faculty really respected my role and like used me as a resource constantly, to now a department where faculty don't even really think of me as somebody who can help. And so that's really difficult for me. It's just the relationship building is really hard, and I don't know how to build that in an authentic way where people who've been here for so long are just so jaded. I don't know how to do that.
Thank you. Others? Jane, there's a...
I also think we need a stronger relationship with HR. I myself had a terrible experience with HR, just terrible. 2 representatives who didn't return my emails or phone calls, who dropped my case, and I didn't even realize it until 8 months later. You know, I just thought, well, that's just UC Berkeley. They don't care about staff. And so the second person I worked with hasn't responded to my inquiries either. So I've just given up. And in effect, I've just said, well, this is just a place where the university doesn't really support employee issues, and that's just the way it is. So I feel like if there is a problem working in our department, there really isn't the advocacy or support needed for the employee, and I think that's a real problem.
Sure. Thank you. I'm sorry to hear about
that. One suggestion is to look at the process for how maternity leaves are handled. It's really confusing and complex, and it's something that is happening every day across campus.
Are you saying the FEMLA process or just everything related to it?
Everything, including the FEMLA. And it's a confusing piece of law, but there isn't, there doesn't seem to be like a standardized guide. Like, for example, they could give you an Excel calendar that would and show you how to calculate like your paid time off versus your unpaid time off. There's it seems like there's a need to create a toolkit there that people in HR who are working on maternity leave could give to the people. That seems like really low-hanging fruit. And like, for example, I created an Excel calendar and I offered to give it to the person in HR. He's like, oh, I can't use that because it's not official. But that would go a long way for helping people feel supported during that big transition in life.
I absolutely understand that. I've had 2 kids in the last 3 years, so I hear you on that one. I think there's someone here.
I've worked for the university for a really long time, and I know I'm not alone. I came to the university knowing I wasn't going to make much money and that I was going to work really hard, and I didn't mind those things because I was, working for a really good cause. But what I've seen in my department over the years is that it seems like the faculty are less invested in the staff. We used to have a lot of staff who worked in our department for a really long time and were really committed in that way. And the faculty seem to have pulled back and taken an attitude we're in a department where there are a lot of faculty involved in startups, and they seem to have a startup mentality now. Like, they like staff who are only there for the short term, and then they have turnover, or maybe they don't care. And so recently, there was a decision about whether to divide the department in two, and the faculty made this huge decision secretly without any discussion with the staff, and I think that really made the staff feel like they weren't important, they weren't trusted, and a lot of people have left. So I think as this other lady over here said, that the relationship building is very important. We've lost so many staff. I looked at our organizational chart from 4 years ago. We've lost half our staff, and we're huge.
Thank you.
Hi, sorry, I have another one related to having babies again. But I feel like I'm speaking with a very empathetic audience, which is, why doesn't UC have paid family leave? That's huge.
Yep.
Yeah, even 2 weeks, and considering that if we were in the city of San Francisco, it seems like that we would be mandated to have it because of city law. So it seems something that's super counter to not just UC Berkeley, but UC's values in terms of supporting women, families, and also an economic justice issue.
Sure. Thank you.
Hey, I don't want to say something inappropriate for the venue, but given the concerns that we're all raising here, I wanted to make sure that everybody is aware that system-wide, UpD is having a new campaign that starts in October to organize student services personnel. And the other campuses seem to be doing more towards helping UpD out on that than the Berkeley campus does. But if you think these concerns might be better done through bargaining, then we should consider getting involved in the UpD campaign. And you saw, I sent out a thing, maybe some of you saw it, about getting some Berkeley people on the profile on UpD's page, because right now it's all UCLA people. So from my point of view, in a Go Bears kind of way, I'd like to see more Berkeley presence on the UpD page. But from the concerns that you're all raising, I think maybe UpD is a way where we could get some attention paid to it.
So as you guys are commenting too, and I do want to thank you for your honesty in your comments. And some of you have already started addressing this, but if you could also comment on ways that we can help improve some of the concerns that you have. If you see some direct synergies between, if it's healthy departments, like what could we do in your departments to help feel, for you to feel more supported or to have more time or whatever it is, so that we can build those into those threshold levels that we're setting for the healthy department goals. Or if it's something from HR or equity and inclusion. So if you could also speak to what can we do to help improve and get you to that healthy campus vision that you have in your head.
So one thought that just came to mind, which is sort of not detailed, but as we're losing so much staff on campus, this is more of a high level conversation in a way, but what can be done to reduce the workload? So if there are less people to do the work, there needs to be less work. And so what cannot be done, what will be streamlined, how can it be encouraged that they're, exempt, you do work more than 40 hours sometimes, but that it won't be a consistent expectation that you work significantly beyond that on a regular basis.
Sure.
How to communicate that at a high level, to rethink workloads, what will happen, what won't.
The Bay Area has a lot of resources, and even in Berkeley, at Berkeley, we have the Center for Greater Good, and then mindfulness training, I think, or mindfulness itself was developed here, or there are a lot of proponents here. So I wish we could take advantage of that a little better. The Center for Greater Good perhaps could have some programs, work with staff. I would love to take the training for mindfulness, but it can be a very intensive process and very expensive. So if there was some way we could have training that was, subsidized or offered. And then having things always offered at the Tang Center is the polar opposite for me on campus. I'm up near Hearst, you know, the
mining circle.
The Greek, yes, yes, exactly. And so, you know, trying to go all the way to Tang and then home in a different direction can be a little challenging. So having satellite resources for things like that.
Do you want to give it to the person behind you?
Well, I think it's interesting when we think about money here. And I know this free speech is a very controversial issue, but of course we had no problem putting up all the money for security. Like that, where does our conviction lay here? Like, okay, we have to pay for security, but we don't have to pay to afford more staff? Like that's optional? So I think we need to reevaluate what we feel convicted about here financially. And I think that if we're going to continue to sponsor these kinds of speakers, for example, who require, you know, $500,000 or whatever it amounts to, well, that needs to be a conversation. Perhaps the student groups really need to cover that if they're putting our campus in that kind of position. And instead, you know, like, okay, well, we had the money for that. Why can't we have the money to support the well-being of our staff, which really fundamentally to me is a matter of hiring more people to offset the excessive workload and to be able to provide better salaries, because we don't have the benefits we used to, which is what motivated people to work here in the first place. And so there's no motivation to stay, and the turnover is incredibly great. We don't have staff with institutional knowledge, so it's very difficult to rely on our colleagues, you know, to address our students' issues. So if we can retain staff, I think that makes a lot of sense. But we need money for the salaries.
Okay, I have a selfish idea. So I don't like to work out at the RSF because I don't want to see my students there. And it's super crowded anyways, and it's hard to get classes that I like. And so, like, I know I think health insurances do this, but sometimes if you can get like a discount or like some sort of money back on your gym membership if you have one somewhere else, or if we can get like partnerships and have discounted classes with like city like fitness places, like all the new cycling studios that are here, or just like yoga places that are nearby, like that would be really nice.
More good ideas?
Thank you. It occurs to me that there's some things that have, in terms of perks that have been removed that maybe we could bring back, like commuter benefits. You know, that free AC transit pass that I used to have for having a carpooling permit was really awesome, and I don't have that anymore, especially when we talk about the high cost of living and then we take away benefits to have our staff commute. Why? You know, we say that we support professional development, but we cut how many extension classes we could take for free, which is, you know, that's a bummer. So maybe reevaluating again, kind of like how are we saving money by cutting things that would build a stronger and more motivated staff.
The popular press has had pieces lately about how sitting is really unhealthy for you. So that's sort of on people's consciousness right now. But most of our jobs are sitting at a desk, looking at a screen all day. And of course, there's always an app for that, where something can buzz and remind us to stand up and sit back down again. But I'd love to see Tang organize something a little more social than that, rather than us individually depending on another app on our screen, to instead say something like, why don't we have like one of those fire drills with two buildings, where like two buildings that are next to each other, let's all walk back and forth between each other's buildings at 10:15 everyone. Or let's all have a little brief treasure hunt at the Camp Neely, or something to get us to move up and move around and chattable amongst each other, So we'll actually do it and have it be sociable and fun, because what I find is I keep on looking at one more thing in my inbox and saying, oh yeah, I meant to get up and walk around the floor 10 minutes ago, but something else came up, and then something else came up, and then something else came up, and before you know it, it's time for lunch.
Interestingly, in one of the stakeholder groups we had, they suggested it'd be great if the Campanile could have a musical tone that plays that just signals to everyone it's time to work out. And we all got up and worked out on campus for those 10 minutes or whatever.
Kind of piggybacking off what Avi said is my manager and I go on walking meetings once a week, and I really enjoy that because it gets me out of the office and moving, and some fresh air while we talk about stressful things is nice.
Sure.
So management is an interesting point. There isn't management training on that level to that it's a great idea, by the way. When I came from industry, there's a lot more training to managers, at least the particular industry I was in, for things like that, to break, shall we say, break the stick. And figuring out ways to be productive and yet also look at health. But if it doesn't come from the top down, I keep saying this, but it doesn't seem to be the message. It seems to be the messages are specific to some issues that have been historic and totally valid, yet our health is significant. It may not be as concrete as that, as measurable, and yet bringing these ideas forward and incorporating from managers and the training. If managers had, shall we say, every 6 months had this sort of training across the board where these policies would go in effect for all campus, that perhaps maybe some of that will trickle down, something to that effect.
Sure. Yeah.
I know we've talked about sort of the financial cost of the health programs. One thing that's shifted just this year is we've lost the benefit of pre-taxing RSF, locker room, and other fees. So it's another, it's another nickel and dime that we don't get in terms of an advantage. So yeah.
I would just like to point out that the RSF costs for staff have skyrocketed at the same time that the campus has decided that students need to be, it needs to be made as simple as possible for students to utilize that resource. And so it became an automatic fee, and they're automatically given access. So while many of us wouldn't necessarily use the RSF, I think it does create a message that we don't count as staff.
Yeah, and I go to the RSF at 6 a.m. to avoid all the students, and it's a great time. It's actually pretty quiet, and there's a lot of community members and faculty and other staff, but that's the first time period that gets cut, and they actually close the RSF or reduce hours from 11 a.m. to 7 p.m. over winter break, which is abhorrent. It means I can't work out at all. And that's at least 2 weeks, and it's just because of student schedules. But there are a decent number of faculty and staff and community members, adult community members at the RSF at 6 a.m. who would like to continue to be able to go. And it would be nice if there were more classes. But that's a different group, I'm sure.
This is sort of piggybacking on a few things that were said earlier, but I'm wondering if there's a way to have some sort of management accountability for wellness in the office. So rather than trainings that occur, well, maybe they do need to take trainings, but also some sort of checklist of seeing, are managers actually offering and allowing access to wellness benefits? Because, for example, we have flex time, we have wellness programs on campus, but do we actually get given the time to do those things? Is it even really considered that if you ask for flex time, you'd be given flex time for your schedule? So I think actually being accountable for those, even having surveys of staff, that do you want these benefits? Are they being granted to you? As a check to see if those things are actually happening, because we already have a lot available, we just aren't able to get access to it. So I think that might be a key, and it's not something that's expensive. It's just creating a system to make sure these things are actually happening, that the university is actually paying for. Because I wonder what your numbers are at all of these wellness events that are already going on. They're probably not nearly what they could be because no one has access, so I don't know. I think staff could probably come up with good components for that type of checklist, or just saying, hey, here's all the benefits that you have.
Mm-hmm. These are definitely helpful suggestions, and they're also really relevant for some of the conversations we're having, both about healthy departments, but also with Joe and HR policies and what managers are expected to do, or policies around trainings for managers and things. So even though Joe, we're from the Tang Center, but all of this will get back to the steering committee and the partners that we're working with, and we do partner a lot with the RSF, so we will certainly share information back with them as well.
So I think I have some faculty in my department who are very nice and respectful, and I enjoy their presence a lot, but then I have other faculty that aren't in that group. And, and I think that there needs, or I would like for there to be some type of like sensitivity training, or like
for the faculty?
For faculty. And I understand that a lot of them are brilliant PhD scientists, and they've been this way for their entire lives, but it does make it hard to interact with them at times. So maybe some type of training for how to work with staff members would be nice.
Academia does not come with social skills.
No.
Well, I want to be mindful of our time. If I could shift gears slightly and get your feedback on our wellness portal. So do you want to speak a little bit more to what it is before we ask for their feedback?
Sure, and with this part, if you could maybe think about both you as staff, us as staff, which is really critical, but also your role with students. One of the things we're going to be doing, as Bahar said, is creating a wellness portal. And this grew out of a lot of feedback from the students that it was confusing to find information about what services there are, or information about health. And as we've been talking to stakeholders and the steering committee met, it became really critical that this web portal, wellness portal, be there for staff and faculty as well, and really focus on the whole community. So whether you think about how to help us inform people about services, how we might do something interactive like the spreadsheet, the checklist, are there tools that we could have on there? Are there ways that we might inspire or engage people to become more active in creating doing relationship building in healthy ways, or helping evolve us into a healthier culture? What ideas and what would you like to see in a wellness portal? And if you don't have ideas for that specifically, but you've been on other sites or portals that you really liked, we'd also like to know what you liked about them. We haven't designed it yet, and we really want the feedback to help us think about not only how to conceptualize it, but what bells and whistles might we have on it.
I just have a really simple issue. When we've had the Optum kind of wellness portal, it was nice and all, but we couldn't log in with our CalNet IDs, which was super annoying. You had some sort of special ID that for me, because I didn't use it that often, I was always getting it lost. So just having it something that's easily accessible through your CalNet, so it's not some extra portal that you have to have an extra login to add to your 27 other ones. So that's just a suggestion technology-wise.
Yeah.
So some things that we've done in the department for students that might be expanded maybe at a higher level for all of campus, or maybe in a larger group, is, so I've worked with our grad students to create like a P&B fit group so that students can maintain their wellness. They do different activities. We've also established a graduate student peer advising group, especially to help transition our first years and to help our second years get through quals. They put on different coffee hours, different workshops. We brought in people from the Tang Center to do an imposter syndrome session. So we've coordinated a lot with the Tang Center. The feedback that I received from students is that they really liked having things in-house versus having to go to the Tang Center. Why that is, I'm not quite sure. Maybe running into undergrads, or just the distance. We are on the northwest side of campus, or maybe because we do have a good community, that a very engaged graduate student community who work in our labs, who are on campus, so they're not off campus, they're always seeing each other.
right? So that's created a lot of community, and it's created a lot of conversation about wellness. By grad students being engaged in that matter, faculty have started to pick up that culture as well, and have been part of that. It's been part of that relationship building. So I'm not quite sure how those activities may be expanded to the entire community or in a portal per se, like for staff, faculty, or students, but maybe even faculty need that wellness piece, and they need a group of faculty, maybe even outside of the department, to do runs or take walks or meditate. I know that some faculty go to Bikram yoga, and some of our students have run into them, and they thought it was awkward, but at the same time, it creates a sense of oh, you're human. You're not just my faculty member. You're a person, and outside of being a grad student, I'm also a person. It humanizes that relationship versus having this hierarchy of grad student, faculty, staff. I've run into them at dinner, and they're oh, and they're treating me like a person, even though they yelled at me in the email. So it does humanizes that. So I don't know, finding a platform where I don't know if it's on campus or off campus, I'm not sure what the solution would be, but to recognize people as people, right? And just having the human decency of treating somebody, appropriately, right?
Others, ideas, thoughts, websites you like, things you want for you or your students. It could be staff resources, etc. There's one behind you.
Hi. So I have to caveat this by saying that I work with a really unique student population. I'm at OS, so professional schools, really different than PhD programs, but a few things I wanted to share out that our students have been doing and that we as staff has been doing to promote and normalize the culture of self-care is our students put on a wellness week, and it's pretty self-organized in terms of different students holding different kinds of exercise classes and students holding meditation groups. We've also tried to incorporate messaging in our communications about encouraging students to kind of figure out how they can take time for themselves and integrate different wellness practices in small chunks, and we share resources like the Greater Good Science Center has I think a website called like Greater Good Science Center in Practice, and so we linked to a 10-minute meditation, and then we also send them information regularly about accessing Tang Center, both physical and mental health resources. But I think there's an opportunity to kind of put together a toolkit of different kind of resources that you can bring to students or different ideas or suggestions. And one thing I would have found helpful is what is the best way to message students about self-care? I just kind of came up with something on my own, but I'm by no means an expert. So different things that people can just reuse and start into their communications, and then different resources. I think there's a ton of different kind of meditation groups across campus. There's a lot going on at OS. If anybody wants to talk to me about that, that's a big interest amongst our student population. So just making it resources really accessible for advisors to give to students and to use in their communications.
Great. Any other thoughts? Go ahead.
Our department about 2 years ago had some issues with students and dealing with microaggression issues with professors. As a result, I think they formally got together with the Tang Center, and now we have an in-house person who comes in, actually has an office, a satellite office within our college. It's been, it's taken a number of months to make that really work, and it seems to be this year it's really taking off. Part of it has to do with the student awareness, staff awareness to some degree, and certainly faculty awareness. And messaging done in so many different ways, not just one, but numerous types. So for example, this Friday is an ongoing thing that this Grad Life Committee does, where they're going to actually meet the doctor, or shall we say this Tang Center representative, who is there and will explain what she's about to staff, or sorry, to students. But the point is it's not just a one-stop thing, it's an ongoing thing. So when I think of your website, I kind of think of it as one of these resources, and some great ideas put out here. To add to that is definitely you go in as yourself, meaning a student, a faculty, etc., but you kind of want to make sure your needs are being met on this particular website versus if I'm with a faculty, my needs may be slightly different than, shall we say, one or the other. That sort of thing, the specific sort of portal that gets me there. And whether they're meetup groups or whatever within the UC context, that's great. But point is that it has been working, what the Tang Center's been doing, and continues to work, but it doesn't just stop. It just, you keep going, you keep dealing with all sorts of things. I'll throw one more thing out there. We've discovered, because it's been over 2 years now, a new subgroup that has been ignored for years, which is the international group, and the issues that go on being an international student. Can't run them over to iHouse to take care of that. Instead, we were trying to deal with this in our area, and it turns out the person that we're working with is from a country that was highly represented in our college, so that's helping some of this branch over. So it's yet something new that we would not even have known a few years ago if it weren't for just the ongoing relationship, and that's very much part of what Tang has been helpful with, so thank you.
Well, so I want to leave some time for Kim if there's any last comment anyone really wants to share. Just as a follow-up, or next steps rather, our plan is to, like I said, we're meeting with key stakeholders over the next couple months, and we're hiring a web developer to work on this wellness portal. And we'll probably come back to you all at some point and show you some kind of product to test and give us feedback on, et cetera. And the goal is to launch for staff, actually, to launch the portal for staff before students. So the goal is to launch this next summer for staff as part of staff appreciation and the staff activities that happen over the summer. So look for this then. And in terms of the healthy departments, if any of you think that your department would be a good candidate to pilot this with, please let me know if you're interested in being a pilot that, there'd be grant money with that too. So if you're interested or curious, my contact information's on that white paper. Please shoot me an email and I'd love to talk with you more. But I think Kim's gonna do the next half, or the last piece, about some important things happening at Tang and SHIP, and let you guys ask questions and things.
Can you hear me? Okay, wonderful. Let me log back in. So I developed a web resource for this group. So if you go to our webpage, it's uhs.berkeley.edu/GSAO, or you can just search GSAO. And what I really wanted to do, we wanted to really leverage this opportunity to get in front of you because you're such a unique group to us, because you're providing this content or this connection to our graduate students who are the highest utilizers of our services as far as their percentage of, they appreciate health. I always talk about when I'm talking to first year students, it's like, yes, you really do need health. And with graduate students, they're like, give me everything. So I have the complete opposite experience as a communications manager. But you play an important role because not only are you that connection, you're also staff. So you're really experiencing us. A lot of you are working with faculty. So you're really experiencing us in this really nuanced way. So we wanted to just spend a little bit of time. Obviously, this doesn't look great, but I wanted to kind of go over some of the key things that could be great resources for you. Some of this might be new information, and some of it, you might already know. One thing is just the basics. So all students, all enrolled UC Berkeley students can use the Tang Center. So I think that's really important. Sometimes there's a misnomer that Tang Center is just the place for students who have SHIP. The majority of students at Berkeley do have SHIP, particularly graduate students, but that, we also have a percentage of students that are not on SHIP, so it's important for them to know. The other thing is that the Tang Center is open 7 days a week during the academic year. I've been at Tang Center for 10 years, and this has really, in the last couple of years that we've had this 7-day-a-week service, it really brings down kind of the anxiety about what am I going to do on the weekend? What am I going to do when I'm closed? And particularly, why is it that on Sunday is the time you have to deal with everything, right? So having urgent care and pharmacy open on Sundays has been a big win. And I wanted to we have a couple of key resources. So I'm not going to really pop over to them, but they're here for your reference should you ever need them. One is our Get Healthcare link. So I will kind of open up our regular website here in another page real quick so you can see this. On our home page, it's at the top right of every single one of our pages. And I really talk about this a lot in orientations because when you're sick, you just want to know, how do I get care? And so all you have to do is go to Get Healthcare. It's really easy. And on this page, we really talk about how are you going to access that care by phone, appointment, and when we're closed. It's just really the basics. The other thing in here is the Go Tang Guide to Getting Started. I will kind of hop on that real quick. This has all of our key services. How do I get in? What's free? It has phone numbers. How do I pay? This is a really good resource as well. One of our most popular ones, and I encourage you to keep that in mind. Sample fees, so just like us as adults, it's always like, how much is this going to cost me? How much is this going to cost me? Our sample fees is also really popular. That's linked on here. And kind of piggybacking off of what you said about the international students, for us, we really do specialize. We're healthcare for all, but we know that some communities, you really want, well, all communities, you want health to be relevant to you, right? So I care about things, there are certain basics that every audience cares about, but international students, for an example, they cannot figure out US healthcare, nor can US citizens. So, I always tell them that too. It's us, it's not you, for real. But if you are a student with a disability, if you are an API student, if you are a Black student, there are things about healthcare and the intersection of the community that you represent that are really important. And so we've been spending a lot of time over the years. We have a really progressive equity and inclusion plan, and we really, a lot of you may notice that we try to spend a lot of time specializing in the marginalized communities. It's really important to us. And at the bottom of our webpage, we have all these unique, especially for pages. So students, faculty, staff, API students, Black students, international students, that's a really robust one. We really appreciate our relationship with the Berkeley International Office on that one. LGBTQ students, we have a Pride page, we have a transgender page and a transgender clinic. Some of you may not know that. For parents and community, as I said, students with disabilities, visiting scholars and postdocs. And also our just launched undocumented students portal. So we're going to continue to expand on those. Again, the basics are health for all. They're not necessarily that different, but the filter and the things that people want to know for certain communities are different. I'm going to kind of pop over now to mental health. Well, did you want to talk? Do you want me to just breeze through? Do you want to talk about immunization or SHIP, or do you want me to just breeze through those two? I didn't know if you wanted to. Sure. Well, I'll go through the rest, and then you can pop in. So I'm going to let Bahar kind of talk about the SHIP and the mandatory immunization policy, just some things we thought you might want to know. It's our purpose today. But we want to make sure to leave time for your questions. Another thing, obviously, that's been mentioned many times is mental health, and also this concept of emotional well-being, right? And regardless of which terms speak the most to you, certainly well-being is important. And in your role, we've got some resources here for students. So first is just what you're probably very familiar with, which is our short-term counseling model. We do really focus on a brief counseling model, so our goal is to get as many people in for that first visit or two, and if they need longer-term care, we refer out into the community. So that is our practice. That's the way it's set up. As you might imagine, with 40,000 students and 50 counselors, it's just not possible for us to see them for their continuous care. We've also been expanding really heavily in these satellite clinics, as was mentioned, really bringing the Tang Center. It's just human nature. The Tang Center is probably 10 minutes from most of your buildings, but the difference between 10 minutes and walking down the hallway is everything when it comes to that precious resource of time. So where we can bring Tang to the community has been helpful. We've also, for you to know that we do have urgent drop-ins, so if you're ever worried about a student, that's another role that you may play. From 10 to 5 every day, we have urgent drop-in. You can walk a student to the Tang Center, they can come to the Tang Center, they don't need an appointment for that. On campus, we also have several in our satellite clinics, Let's Talk drop-in. What these are really more informal drop-ins that don't require appointments, they're on campus, and importantly, they don't generate medical records. Medical records are confidential, but some students, like maybe law students in particular, people are very anxious about, is this gonna go on my record? So just knowing that we're really trying to offer as many different ways as people can seek mental health based on what's most relevant for them. One of our most popular services, it's absolutely exploded, is this health coaching model. So these are health educators that actually offer different types of free appointments for students based around, you could talk to them about time management, talk to them about really anything that's bothering you, relationships. Graduate students actually use these services as well, so it's not just for undergrads. And that health coaching just offers something different for someone who maybe they don't really feel like they need to talk to a counselor, but they definitely would like some help dealing with some issues. And a lot of sexual health, but not in the way that graduate students really need. They got that one figured out. Our Be Well, this is our basic, hopefully you've seen that, kind of Be Well at Cal is our wellness program that's targeted to students, and Be Well at Work is kind of the wellness umbrella, if you will, for staff. But the Be Well site for students really is divided into 10 core areas of health, and there are tons of resources nestled in there. So this is a really good one for just how do I prioritize gratitude? You talked about greater good science, like how great is that? Mindfulness, that's as much a part as time management as what about your career? We know that that's a huge stressor for graduate students. So there are a lot of different elements, and that Be Well site is really designed to do that. Look for the Signs is a really great resource for looking for the signs of depression. I brought some bookmarks in the back. And this is just really what do you look for, and then what do I do if I'm worried? Stress, anxiety, and depression are the second kind of top reason that students come to this Tang Center. So it's really important for us to make sure that we get those resources out. And then there's also things like rest zones, going to take a little nap or going to the Tang Center to massage chairs. And also, aside from the physical components, it's the cultural component, right? We're saying it's okay to take a break. Now, we can also laugh as staff because I hear the time constraints, but what we're trying to do is build a culture of, yeah, you go sit in that massage chair for 15 minutes and don't do anything and don't feel bad about that. Resting your body and kind of making time for that wherever you are. So there's a rest zone. This is a nap map, so this is a Google map of all the places you can nap or get massage chairs, so take advantage of that. And pet hugs are not just for students. So out here, every Tuesday, Andy, sometimes you come out and see me, right? Get your pet hug. So we have pet therapy dogs, and then during RR week, we do them for a couple of days at Moffett. But we've really been trying to also let staff know. I mean, dogs are like for everybody, right? Not just for students, so come on out. Resources to assist students. So you probably regularly receiving, we're getting ready to put out another Cal message about some opportunities that we have to help train you. So we know training and getting access to that is really difficult. This is at the Tang Center, so sorry about that. But we do offer every semester QPR trainings, which is a type of gatekeeper training, particularly around assisting people in distress, suicidality. That is a free workshop. We have them for students, and we also have a faculty staff /GSAO, even though it doesn't say that, options at Tang. And then in the past year, we've also been doing something, a psychological first aid training. So we couldn't leave this room without all of us acknowledging just the climate that we're in and the constant tension and the constant pressure. It's like a pressure cooker for a lot of us, particularly if you are dealing with marginalized communities or communities that feel under threat. Maybe that is yourself. And so I think kind of knowing how can every person kind of work together when there is this tension and pressure. It's not just the Tang Center, our 50 counselors coming out. How do we really empower people everywhere to kind of, what do you need to do to really take care of the kind of mental health and wellness of your whole group? So if you're interested in that psychological first training, here's some dates. And then we have a lot of resources here. So the mental health handbook, that is one of the things we have in a companion piece to the gold folder. There are a lot of resources assisting students in distress, link on how you can call CPS. You can always contact CPS because of privacy rules. They're not going to be able to get back with you and say, hey, Johnny followed up and did this. But you can know that if you're worried about someone, you can get some consultation. And then, of course, resources for you as staff. And so we have employee assistance. It used to be called care services. That employee assistance is really there for you to support you in addition to a lot of other Be Well at Work resources. So it sounds like a lot of you are familiar with the workshops. Thank you. Here's a little flyer for it. And we do know that it's kind of difficult, right, the in-person. I think all of us recognize that in-person, it's really hard for everyone to give their time. But I won't go through all of these, but just a reminder on those Be Well at Work resources, it does take the ability to have more time, but we do want to remind you that these resources are available, particularly some things you may not be as familiar with, elder care assistance, ergonomics, and of course you're probably most familiar with our wellness unit. They're the one that do a lot of our programming out on campus, and also this work-life website is a really great resource for the different policies and the different things that are available, and it really breaks it down nicely for faculty, staff, and also for graduate students, so that might be a good resource for you. We're going to save time for questions, but I want Bahar to kind of just briefly give a few updates about SHIP and the SHIP. Everyone, and mandatory immunization and TB screening. Bahar has all of your topics.
Sorry, is this on? Yeah. So SHIP enrollment dates changed moving forward. It used to start August 15th every year. It now starts August 1. And for you all, this has a couple of impacts. One, the reason for this was so that it aligned better with health plans in the marketplace, right? No other plans start in the middle of the month. And so what we were seeing is that students either had to pay for dual coverage for 2 weeks or they had 2-week gaps. And so we were trying to avoid that. And so now it starts at the start of the month and ends at the end of the month. So it's August 1 through July 31. The piece that's critical for you all, though, is that with the new systems changes, Cal Central, all that, what that means is that students don't actually show up actively on SHIP, like if they need to go and use their Anthem ID card, until they're enrolled in units, even if it's 0.5 units. Because the way it works is they need to get billed for them to show up on the enrollment file that goes over to our insurance carriers. And so they just need to be in some kind of unit, even if it's a PE class. If they end up enrolling, say, the 5th week of class, their coverage will still backdate to August 1, but if they show up in an emergency room on August 2nd, it's not going to show as they're on SHIP unless they're actually enrolled. And so I say that to you all to the extent that you can, to encourage your students to sign up for units in advance, even if they end up dropping whatever that is or switching units, or some of the departments, Haas has been really great about preemptively enrolling students in units, just one unit, bogus unit that they've then fixed later on. But it is tied to that, and we really can't get around it with the system that is in place right now.
2 issues around that. Incoming students can't register. 2 issues. Incoming students can't register until a couple days into August. And then I have a lot of students who file over the summer. And so the filing deadline is like August 12th or something. So that means that they have 2 weeks where they could be filing their dissertations, but they don't have coverage. So that's just, I know.
Yeah, so a couple things. So again, Haas has been a great partner with us for the incoming students. They've preemptively enrolled their incoming students on their own in a unit. And you can work with GradDiv, has been my understanding, to arrange things like that to get them to enroll earlier in August. So if you let us know, we can work with the registrar on this, because what we've seen is other departments have been able to do it. And so I'm happy to have more of those conversations with our partners at the registrar to see what we can do. I don't know if you're going to comment.
Well, I also believe that next year, because of, you're going to start to talk about the TB
Yeah.
requirement, I believe we're going to matriculate students.
Earlier.
Meaning Beatrice will move them over to the registrar system earlier, and they will get earlier enrollment dates. Now, Doug and Ricky and others in Office of Registrar haven't finalized this, but that's what we're planning, because we recognize that we're going to have an August 1st problem when you get on to your next topic.
So a couple other things. If your students who are graduating, if they were enrolled in a summer session, we actually let their eligibility bleed into August. So I know it's a little different for filing fee. We also allow students to buy one additional semester of coverage. So if they think they're graduating or they're going to take a leave of absence because they had a baby and they want to take some time off, we allow them to extend their coverage for one additional semester. So those are some possibilities. But if there's something specific to your population or your student, please come talk to me, because we might be able to work something out. We have, especially for the professional degrees, we have some that are off-cycle SHIP periods where, you know, the LLMs actually end 8/31 instead of 7/31. So we've made special arrangements, and we can do that for your department. The other thing is, if they think they're going to be here in the fall, please have them submit a waiver. The waiver deadline is pretty firm. August 15th is the waiver deadline. We don't take them after that. Now, we'll make exceptions if you have a student that was legitimately a late admit, for example. Please contact our office so that you can verify they were a late admit, and we can work with you on that. But we do get a lot of students, especially grad students, who just weren't thinking about what's going on in the summer. They didn't read their emails and things like that, even though we send out multiple communications saying these waiver deadlines are coming up. And I'm happy to keep answering SHIP questions, but I do really briefly want to mention this immunization piece. So about 2-3 years ago, the Office of the President system-wide put out an immunization and mandatory TB and immunization policy. So what this says is that all incoming students, including transfers, have to meet certain immunization requirements and have to be TB cleared. That doesn't mean that everyone needs a TB test, but they have to fill out a questionnaire, and if they're marked as high risk, then they need to do a second set of TB clearances. So until now, it's been a soft compliance. It's been a, we'd like you to do this, but for next fall of 2018, there are actually registration holds that go in place with it. There is a grace period, so their holds don't hit for fall, they hit for spring. But what that means is, starting in September or in October, they're going to start seeing holds on their records if they have not been compliant. We start sending out notices to the students about being compliant in April. Essentially, as soon as they get their admissions notifications, we start telling them, hey, you have this requirement. Now, we also have a ton of resources on our website that are linked, if you link to that mandatory immunization page, that says, you know, local places in the area that you can go get these immunizations if you don't have them. We have a form if they have questions about, I don't know if, you know, I'm from X country and I don't know if this is the same thing as what you're asking for. So we have a ton of resources available to them. And if they're on SHIP, you know, they can obviously use SHIP to become compliant. But the deadline really is August 1 to be compliant, and holds start hitting sometime in September, October. So, you know, to the extent that we can work with you to do special messaging and batch messaging to your students, especially if you have a high international population, please let us know. We'd be happy to work with your departments. Kim and I have been partnering on a lot of that communication stuff. Questions?
But I just want to confirm and clarify that if for some reason a student is not able to complete the TB screening prior to August 1st, they will, once they come to Berkeley, be able to get that done free of charge at the Tang Center?
So August 1st is the deadline to meet their immunization requirement. Now, obviously, for our students who are in remote areas or can't meet that, we know there's going to be a lag in getting those requirements met. So if they need to meet it, you know, between August 1 and September 1, they can come to the Tang Center to do it. It's not free. It depends if they have SHIP coverage or not.
And if they have SHIP coverage, what's the cost or anticipated cost?
So for SHIP students, the majority of what they need is covered fully. For non-SHIP students, they can use that sample fees page to see what it is that they need. Is it a TB blood test? Is it a titer, which is a type of test to see if you have an immunization, et cetera. So, and they can self-order a lot of the tests online and then go to the lab and do them. So,
And
yeah.
I think
students to come to campus already with that immunization. So I think that's one of the things, we really encourage them to get it before. If they're residents of California, we know for some students, particularly international students, they may not be able to do it. We know that even with the ACA policy that all students are insured, we know that all students are not, and some of them don't have insurance. So we do make exception, but the guidance is not come to campus and then get what you need. It really is get it before you come.
Especially for the tuberculosis.
Exactly.
We really want them to come in having met the requirement so that they're there's less risk on campus for everybody else.
Because depending on what the deficiency might be for that student that they're meeting, it could be something that could take months and months and months for their system to get ready, and they're already going to classes, they're living in congregate housing, so it's really critical that they get it done, and that is the push. So that's the messaging you'll hear from us. Also knowing, of course, they can get it at as many months as they can.
But we're going to push the August 1 deadline. We're not going to say, oh, come here and then get compliant.
So, given that, you might not like this idea, but what about using like the International Student Orientation or NGSO as a place to, you know, if people have not complied, where they could actually, you know, get the tests or whatever?
Yeah, we've done some outreach with Bio and NGSO. We'll continue doing that, but really the push is going to be before they show up on campus. Now, obviously, we'll keep trying to get them compliant as long as it takes us to get them compliant. And they'll certainly start feeling it when those schools go in. But as Kim said, the public health approach really is to get them compliant before they're physically here on campus.
Yeah, I don't know if this is true or not, but some of my students were complaining that the TB test requirement was more strict than what the CDC actually recommends. Is that true? Because I had like a student who was traveling in Peru or in South America for like 2 months, but otherwise had been living in the US the whole time. It was just like her summer trip before she started grad school, and then it said she was required and she wasn't able to do it until she got here, and then she was complaining about it. I didn't know if that's true.
So don't quote me on this. I will go back and check, but I'm pretty certain that the recommendation, that what they're using to build this is what the state recommends. Yes. I don't think it's the federal guidelines, it's the state of California guidelines. Yeah. So the state of California might be more strict on certain things than the CDC is.
Yes, that is true. Generally speaking, CDC is that overall guidance. In several cases, the state of California is actually more strict on that guidance, and we follow in public health a chain of command up through the city of Berkeley, up through the county, up through the state. The state obviously is accountable to the federal, but we really go in line with the state when it goes up, and so those are the policies that we see.
Other questions? SHIP, immunizations? Yeah.
I'm just wondering if there are any thoughts with moving forward with requiring any kind of insurance for visiting students in the summer, because there is no insurance requirement for those students, and they do get ill and have illnesses that are beyond what the Tang Center can cover. Additionally, if there will ever be immunization requirements for that population, because they do arrive with illnesses and sit in classes and in dormitories with other students.
So the thing with insurance, right, is that unless you mandate it for everybody, it becomes the people who need it sign up for it, and then it drives the cost up for everybody else. And so, unfortunately, the mandate right now from the regents only applies to registered students in the fall and spring. And so we can't just make an opt-in only program for the people who are interested in the summer, because the cost would be exorbitant for them. So if there's a program who wants to work with us to mandate that, we're happy to do that for those programs. And in fact, full-time students who start in the summer, we do have those mandates in place. Like there's the MPA program, the public administration, they start, or public affairs, they start in the summer. We mandate it for their program as they start. Same with education, they have a summer start group. But for the students that are truly visiting students, unfortunately, there's no cost-efficient way to do it for the students and for the university. Other TB questions or immunizations, SHIP questions?
Or any questions?
or any Tang UHS questions at all, we'd be happy to answer them.
Not this page, but the one that you guys were on before, that one, where is that? I'm having a really hard time finding it.
Oh, this page right here? This
The-
is, if you just search,
If you just type in GSAO.
Yeah, I did, and it says 0 results found.
Oh, it does. Huh, you're right. I just tried that too.
That's one of the limitations of Open Berkeley search feature. It should be popping up, but I'll go in and add a few keywords, so it will. If you just go to
Type in top resources, it comes up.
If you, see, you have to build in a dummy workaround, so we'll do that. Yeah, if you go to
20 matches.
/GSAO, and also just from Google.
So that's the website to the extent
I got
that
it.
you can see that.
Well, you go to just Google.
Yep.
And type in, I bet if you type in GSAO and UHS, it'll probably pop up. Did it?
No.
It takes you to the home
Oh,
page.
you know, we just created this, so one of the things Google may not have indexed it yet.
Yeah, I think it's too
Search,
new.
Sometimes it takes a day or two for that to like.
But it's uhs.berkeley.edu/GSAO. Is that it? Okay, that's all I needed to know. Thank you.
You can. It'll reroute you. No, it'll reroute you here.
Yeah. Hopefully once Google index that, because we just spun this up, so hopefully it'll be in this. I think so, and we'll continue to kind of update this for you. As a matter of fact, I was thinking, oh yeah, we just created a new video. It's like a 4-minute video on how to use Tang, so I'll throw that in there. And if there are any suggestions or anything you'd like to see added, please let us know. You can email any of us directly, or that email address on the bottom of the website goes to me, Tell Tang, which, by the way, is always, I just want to offer that up as a resource to all of you, particularly if those of you that are struggling with students that have SHIP questions or have immunization questions. We have email addresses and contacts for most all of our departments, and you do not have to suffer for that one bit on your own. That's what we're here for, to help you with that, particularly because it's usually really complicated. So we will take that load off. You can refer directly to Tell Tang. This happens for a lot of departments. That comes to me, and I manage it and triage it, and I'll take it off your shoulder. So or anything like that you have, you can always just email Tell Tang. We'll take it from there and take a little bit of load off of you. There's one thing you can do for your emotional well-being.
Similarly,
Let's help you a little.
similarly, if your students are having trouble navigating healthcare, especially if they're on SHIP, please send them to our office, ship@berkeley.edu. We'll take care of it. If they're having claims problems, or whether it's mental health, medical, dental, vision, you can send them to us and we'll help. You know, we'd like to be advocates and champions for our students to the extent that we can.
I can't see from this far out, but if you could add something on maybe substance abuse or social services, I don't know if you have that up there already. That'd be great.
Trying to make this bigger for you all.
Yeah. So off the counseling link, it will have social services in there, but I'll add a particular link for social services, which is our specialty counseling arm that really deals with a range of issues from nutrition to alcohol and drug, identity counseling, sexual assault and violence response, a lot of really big, important issues. So that's great. I'll add that resource on there for sure.
Any last minute question? Well, thank you all so much for your time and all your input. It's really been helpful for us, and we really value your honest feedback. So thank you so much. And if there's anything you think of afterwards, feel free to email me. My email's on the paper that you got. And thanks, Andrea, for hosting us.
I really want to thank Bene, Bahar, and Kim for attending. I thank Larissa for taking notes, because I know we have a Healthy Campus Network meeting tomorrow where we will use this information. Thanks to Jane for playing Phil Donahue with me. And I just want to say good luck today. It's going to be a challenging day, but I'm really glad you came. Thank you for your honest, forthright expressions of what's going on, even though I know this is streamed and so it's not entirely private. I think it's important for us to be straightforward about what's going on for us, and so I really appreciate everyone who shared their experiences. Thanks for coming. Have a safe day.